This video is about nerves and their plexuses. So when a nerve leaves the intervertebral foramen, they kind of weave together and they form these things called plexuses. So there are 5 plexuses in the body: a cervical, a brachial, a lumbar, a sacral, and a coccygeal. So in each plexus there are nerves that provide whether sensory or motor or both innervation to muscles and other organs such as the skin, and those are what allow us to detect and respond to stimuli in our environment. So in the cervical plexus, we have some nerves that are coming from the lesser occipital nerve. Picture here. The lesser occipital nerve innervates posterior to the ear, so behind the ear in this top area. Then we have the great auricular nerve that is going to innervate processes of the outer ear. Further down we have the transverse cervical nerve, which is sensory to the neck area right around here, and that's going to be sensory innervation. Then we have the ansa cervicalis. What that does is it innervates the infrahyoid muscle. That one is in a motor capacity though. And then we have the phrenic nerve, which is extremely important. That is what innervates the diaphragm, gives us the ability to breathe. We also have the supraclavicular nerve. That is the sensory innervation to the anterior shoulder area. The next plexus that we have is the brachial plexus. Brachial plexus is located right here, coming out of the spine, and this is going to focus on the arms. So the brachial plexus, we have the musculocutaneous nerve, and what that does is it innervates 3 muscles in a compartment of the arm. We have the cocobrachialis, the biceps brachii, and the brachioradialis, as well as part of the lateral forearm, which allows us to move it. All the nerves of the brachial plexus are mixed innervation, so they provide both sensory and motor capacity for it. From there we have the axillary nerve. That is going to innervate the deltoids and the teres minor muscles and gives us the ability to move our upper limb. Then we have the radial nerve, so that is going to be motor and sensory innervation, and it gives us the ability to straighten our upper limbs. So further down we have the medial, which is sensory motor. Once again, so what that's going to do is give us the forearms, the wrists, the hands, and give us the ability to extend those and straighten those. And then we have the ulnar nerve, which is again sensory motor, because all these nerves are mixed innervation to the hand and the forearm. So moving further down, we come into the lumbar plexus. Right here. It's going to come out right above the pelvis area, and then innervate many of the nerves of the leg. So in the lumbar plexus, we have the iliohypogastric nerve, which provides sensory motor innervation to the abdominal and anterior portions of the lower limbs and for the skin. And we have the ilioinguinal nerve. The ilioinguinal nerve is going to innervate areas like the male scrotum and the female labia, as well as the internal abductors. Then we have the genitofemoral nerve, which is going to be sensory motor innervation as well. It's going to innervate the mid-anterior thigh, so kind of that adductor area, and the male cremaster muscle. We have the lateral femoral cutaneous nerve, which is going to provide sensory innervation to the upper lateral thigh. Further down, we have the femoral nerve, which is sensory motor innervation to the quads, the sartorius, the skin, the thigh, the knee. Then we have the obturator, which is going to innervate the medium thigh and the adductor muscles. So from there, we have the sacral and coccygeal plexuses, which are located coming out of this area, down in this coccygeal point at the bottom with the sacrum. And it's also going to focus on the lower limbs. So what those are going to innervate are, we have the superior gluteal nerve, which is going to innervate the hip in a sensory motor capacity, as well as the glute minimus and the tensor fasciae latae, the TFL muscle. We also have the inferior gluteal nerve. What that's going to do is innervate the gluteus maximus muscle in a sensory capacity. Then we have the posterior cutaneous muscle. So in a sensory innervation, This one is going to innervate the mid-thigh, upper post leg, and some of the glute. We have the tibial nerve, so in sensory motor capacity, this is going to innervate the hamstrings, posterior leg, posterior skin, that kind of thing. Then we have the fibular nerve, so that's going to innervate the biceps femoris, muscles at the back of the leg, the posterior of the leg, in a sensory motor capacity. Then we have the pudendal nerve, so that is going to innervate, again, in a sensory motor capacity, skin in the genital area.